Have you ever experienced sudden cramps at night? Or felt your legs becoming weaker, making it harder to walk steadily like before? This is a condition that many elderly people face. The cause isn't just aging, but also a deficiency in essential vitamins and minerals. If not properly supplemented, the pain, leg weakness, and nighttime cramps will worsen over time. It can even affect mobility and overall quality of life. So how can we strengthen our legs and reduce cramps without relying on medication? In today's video, we'll explore 7 essential vitamins and minerals that help you increase leg strength, reduce muscle cramps, maintain healthy mobility every day. Watch the full video to take care of your legs and your overall health in old age, smartly and effectively. 1. Calcium. Calcium is one of the most essential minerals for maintaining strong and healthy legs, especially as we age. It's best known for its role in building and maintaining bone density, but its importance goes far beyond just the bones. As we get older, the body becomes less efficient at absorbing calcium from food, which leads to gradual bone loss. This condition, known as osteoporosis, can make the bones in the legs more fragile, increasing the risk of fractures and falls, especially in seniors. Weak bones mean less support for your muscles and joints, making it more difficult to walk, stand, or even get out of bed comfortably. But that's not all. Calcium also plays a crucial role in muscle function. Every time a muscle contracts, including those in your legs, calcium ions are involved in triggering that movement. Without enough calcium, muscle contractions can become weak or erratic, leading to discomfort, spasms, or leg cramps, particularly at night. If you frequently feel your legs trembling when you stand, or you've experienced sudden cramps while sleeping, calcium deficiency might be a hidden cause. So where can you get more calcium? One of the best sources is dairy. Milk, cheese, and yogurt are all rich in easily absorbable calcium. But if you're lactose intolerant or avoid dairy, don't worry, there are plenty of alternatives. Leafy green vegetables like kale, collard greens, and bok choy contain good amounts of calcium. So do almonds, tofu, canned sardines with bones, and fortified plant-based milk such as soy or almond milk. And here's something important to remember. Getting enough calcium through diet alone isn't always enough. Your body also needs vitamin D to absorb calcium efficiently. So if you're supplementing with calcium, make sure vitamin D is part of the equation. Experts generally recommend that adults over 50 get about 1,200 milligrams of calcium per day, either from food or supplements. However, it's important not to exceed the recommended dosage without medical guidance, as too much calcium, especially from supplements, can cause kidney stones or other complications. In summary, calcium is more than just a bone builder. It's a muscle supporter, a leg strengthener, and a key to mobility in old age. Including calcium-rich foods in your diet every day can help prevent leg pain, reduce your risk of injury, and keep you moving with confidence as the years go by. Let your bones and muscles know they're still a priority. Give them the calcium they need to support you every step of the way. 2. Vitamin D. Vitamin D is often called the sunshine vitamin, and for good reason. It's produced by the body when our skin is exposed to sunlight, and it plays a vital role in maintaining strong, healthy bones and muscles. For older adults, especially those who suffer from leg pain, fatigue, or limited mobility, vitamin D deficiency could be a hidden but serious problem. One of vitamin D's primary functions is to help the body absorb calcium, the mineral responsible for building and maintaining strong bones. Without enough vitamin D, even if you're eating calcium-rich foods or taking supplements, your body can't use that calcium effectively. The result? Weaker bones, which can lead to leg pain, instability, and in more severe cases, fractures or osteoporosis. But that's not all. Vitamin D also plays a major role in muscle health and nerve function. If you're feeling tired, if your legs often feel heavy, weak, or shaky, vitamin D deficiency could be to blame. Low levels of this vitamin have been linked to muscle weakness, especially in the lower limbs. This can increase your risk of falling, which is a major concern for seniors. And the scary part? Many people, especially older adults, are deficient in vitamin D without even realizing it. As we age, our skin becomes less efficient at producing vitamin D from sunlight, and we tend to spend less time outdoors. Add to that a diet low in vitamin D, and the deficiency can sneak up on you. So, how can you make sure you're getting enough? First, spend some time in the sun, about 15 to 30 minutes a day depending on your skin tone and the time of year. Expose your arms, legs, or face to the sunlight, but avoid overexposure or sunburn. This natural method is the easiest way to boost vitamin D levels. Second, include more vitamin D-rich foods in your daily diet. Fatty fish like salmon, mackerel, and sardines are excellent sources. So are egg yolks, liver, and fortified foods such as milk, cereals, and orange juice. For many older adults, especially those with limited sun exposure or dietary restrictions, a vitamin D supplement might be necessary. The general recommendation for adults over 50 is 800 to 1000 IU per day, though some people may need more based on their blood levels and health conditions. Always consult your doctor before starting any new supplement. Finally, remember that vitamin D doesn't act alone. It works together with calcium and magnesium to keep your bones and muscles strong. Think of them as a team. Each one supports the other to give you better mobility, balance, and freedom from leg pain. In summary, if your legs are aching, if you're feeling tired, or if your muscles seem weaker than before, don't ignore the possibility of a vitamin D deficiency. Getting enough of this vital nutrient could be the key to regaining strength, energy, and confidence in every step you take. 3. Vitamin B12. Vitamin B12 is one of the most important nutrients for maintaining healthy nerves and red blood cells. And yet, it's also one of the most overlooked, especially among older adults. If you're experiencing persistent leg pain, tingling, numbness, or even problems with balance, a vitamin B12 deficiency might be the root cause. Vitamin B12 plays a critical role in nerve function. It helps protect the myelin sheath, a protective layer that surrounds your nerves. Without enough B12, this protective coating begins to break down, causing nerve damage. That damage often starts in the legs and feet, leading to symptoms like burning, tingling, pins and needle sensations, or numbness. Some people describe it as if ants were crawling under their skin. But the effects aren't just physical. Low B12 levels can also impact your mental clarity, mood, and energy. You might feel more tired than usual, struggle to concentrate, or feel depressed, symptoms that are often mistaken for just getting older. The problem is, as we age, our body becomes less efficient at absorbing vitamin B12 from food. This is especially true for people over 60, or those taking certain medications like antacids or diabetes drugs, like metformin, which can interfere with absorption. So, how can you tell if you're deficient? The only sure way is through a blood test. But if you've been dealing with strange sensations in your legs, unexplained fatigue, or issues with balance, it's definitely worth discussing with your doctor. To boost your vitamin B12 levels, focus on animal-based foods, like beef liver, red meat, eggs, milk, cheese, and especially fish and shellfish like tuna and clams. These are among the richest natural sources of B12. If you follow a vegetarian or vegan diet, or if your body has trouble absorbing B12 from food, you may need supplementation. This could be in the form of oral tablets, sublingual drops, or even injections in severe cases. The good news is that B12 supplements are generally safe and well tolerated. But don't wait until the damage becomes irreversible. Long-term B12 deficiency can lead to permanent nerve damage, particularly in the legs and feet. That's why early detection and treatment are so important. In conclusion, if you've been struggling with numbness, tingling, or weakness in your legs, especially if you're older, don't overlook vitamin B12. This simple nutrient might hold the key to reversing symptoms, restoring your energy, and protecting your nerves for years to come. Sometimes it's not just age, it's a deficiency that can be fixed. 4. Magnesium. Magnesium, it's one of those minerals you don't hear about as often, but it plays an incredibly important role in your overall health, especially when it comes to muscle and nerve function. And if you're dealing with leg pain, cramps, or restless legs, a magnesium deficiency might be one of the hidden causes. Magnesium is involved in more than 300 biochemical reactions in your body. One of its key roles is helping your muscles contract and relax properly. When your magnesium levels are low, your muscles can become overly excitable, leading to spasms, cramps, twitching, or that uncomfortable tightness many people feel in their calves or thighs, especially at night. Have you ever experienced waking up suddenly with a painful leg cramp? That could be your body's way of signaling it's running low on magnesium. But magnesium isn't just about muscles. It also supports your nervous system, helping regulate signals between your brain and body. A deficiency can lead to nerve-related symptoms, including tingling or numbness in the legs and feet. It can even contribute to anxiety, insomnia, and fatigue, all of which can make leg discomfort feel worse. So, what causes magnesium deficiency, especially in older adults? There are a few main factors. First, as we age, our body's ability to absorb magnesium from food decreases. Second, certain medications, like diuretics, antibiotics, and drugs used to treat acid reflux, can cause the body to excrete more magnesium than usual. Third, poor diet plays a role. Many processed foods are low in magnesium, and few people eat enough of the foods that are rich in it. Now, here's the good news. Magnesium is found in many delicious and healthy foods. To naturally increase your intake, focus on dark leafy greens like spinach and kale, nuts and seeds, especially pumpkin seeds and almonds, whole grains, legumes, avocados, bananas, and dark chocolate. Yes, a square of dark chocolate a day can actually help your muscles relax. If dietary changes aren't enough, magnesium supplements are widely available. They come in many forms, such as magnesium citrate, glycinate, and oxide. Among these, magnesium glycinate is often preferred for people with muscle pain or sleep issues, as it's gentle on the stomach and well absorbed. However, it's important not to overdo it. Taking too much magnesium from supplements can lead to diarrhea or digestive upset. That's why it's best to start with food and consult your doctor before beginning any supplementation. In short, magnesium is a key player in muscle and nerve health. If you suffer from leg cramps, unexplained muscle stiffness, or nerve discomfort, especially at night, low magnesium levels might be to blame. The fix might be as simple as adding more leafy greens to your meals, snacking on a handful of nuts, or making sure your body is getting enough of this essential mineral. So don't ignore the signs. Sometimes that irritating leg cramp is more than just a nuisance. It's your body whispering for magnesium. 5. Potassium. Let's talk about potassium, a mineral that's often associated with heart health and blood pressure. But did you know it also plays a major role in muscle function and could be a key factor behind leg pain and cramps? Potassium is essential for proper muscle contraction and nerve signaling. It helps regulate the fluid balance in and around your cells, including those in your muscles. When your potassium levels are too low, a condition called hypokalemia, your muscles may not function properly. This can lead to cramping, weakness, fatigue, and even muscle spasms, particularly in the legs. Have you ever had that sudden sharp cramp in your calf while walking or sleeping? That could be your body's way of crying out for more potassium. One thing many people don't realize is that potassium works closely with other minerals, especially sodium and magnesium, to maintain a delicate electrolyte balance. When that balance is thrown off, such as from excessive sweating, diuretics, poor diet, or dehydration, the result can be painful leg cramps or ongoing discomfort. Older adults are especially vulnerable to potassium deficiency. As we age, our kidneys may not regulate potassium as efficiently, and some medications, like blood pressure drugs or water pills, can cause our bodies to flush out too much of this vital mineral. So, how can you make sure you're getting enough potassium? Luckily, potassium is found in many whole, natural foods. While most people immediately think of bananas, and yes, they're a great source, there are even better potassium-rich options to include in your diet. These include sweet potatoes, white beans, spinach, avocados, coconut water, beet greens, squash, and oranges. Incorporating a mix of these foods can help keep your potassium levels steady and your muscles functioning smoothly. But here's a word of caution. Too much potassium can also be dangerous, especially for those with kidney disease. The kidneys are responsible for filtering excess potassium out of the body, and if they aren't functioning well, potassium can build up to harmful levels. That's why it's important to check with your doctor before taking potassium supplements, especially if you're already on medication. That said, dietary potassium from food is generally safe, and most people can benefit from increasing their intake through whole, unprocessed foods, not pills. So, in summary, if you're experiencing frequent leg cramps, muscle fatigue, or weakness, especially at night or after physical activity, potassium deficiency might be a hidden cause. Making simple adjustments to your meals, like tossing some spinach in your smoothie, having a baked sweet potato for dinner, or drinking coconut water after exercise, could help reduce discomfort and improve overall muscle performance. Sometimes, relief doesn't come from a prescription, it comes from your plate. And potassium may just be the nutrient your legs have been begging for. 6. Vitamin K. Now let's explore vitamin K, a lesser-known nutrient that plays a surprisingly important role in bone health and may even be connected to leg pain, especially in older adults. When we think of vitamin K, most of us associate it with blood clotting, which is true. Vitamin K helps your body form clots to stop bleeding when you're injured. But there's much more to this nutrient than that. Recent research has shown that vitamin K is essential for maintaining strong bones and preventing calcium buildup in the wrong places, like your arteries or joints. Here's how it works. Vitamin K activates a protein called osteocalcin, which helps bind calcium to your bones. Without enough vitamin K, calcium can start accumulating in soft tissues instead of being delivered where it's needed most. This can lead to weaker bones and painful calcification in joints and blood vessels, both of which can contribute to discomfort in the legs. For older adults, this is especially important. With age, the risk of osteoporosis, joint stiffness, and circulatory problems increases, all conditions where vitamin K plays a protective role. In fact, low vitamin K levels have been linked to increased risk of fractures, arterial stiffness, and even leg cramps or restless leg sensations, particularly when combined with deficiencies in vitamin D and calcium. So, where can you get vitamin K? There are two main forms: vitamin K1, found mostly in leafy green vegetables, and vitamin K2, which is found in fermented foods and certain animal products. The best sources of K1 include kale, spinach, broccoli, and Brussels sprouts. For K2, look for foods like natto, fermented soybeans, cheese, eggs, and liver. Both types are important, but K2 is particularly effective at directing calcium away from the arteries and into the bones, which is key for preventing the kind of pain and damage that can show up in your legs. Most people don't get enough vitamin K2 from diet alone, especially if they don't eat fermented foods. If you're concerned, talk to your healthcare provider about whether a K2 supplement might be right for you, especially if you're already taking calcium or vitamin D, as they work best together. In short, vitamin K is more than a blood clotting vitamin. It's a bone and circulation protector, and it could be quietly contributing to or relieving the leg pain you're feeling today. 7. Vitamin B6. Let's now talk about vitamin B6. A powerful but often overlooked vitamin that can have a huge impact on nerve health and leg pain, especially in older adults. Vitamin B6, also known as pyridoxine, plays a crucial role in your nervous system. It helps the body produce neurotransmitters, the chemicals that allow nerves to communicate with each other and with your muscles. It's also vital for producing red blood cells and maintaining healthy brain function. But here's where it gets especially interesting. A deficiency in vitamin B6 can lead to nerve damage, also called peripheral neuropathy. This condition can cause tingling, numbness, burning sensations, or even sharp pain in the legs and feet. Many elderly people mistakenly think these symptoms are just a natural part of aging, but in some cases they could be linked to low B6 levels. At the same time, it's important to be aware that too much B6, especially from supplements, can also cause nerve damage. So, while this vitamin is essential, balance is everything. So, how do you know if you're getting enough, but not too much? Most adults need about 1.3 to 2 milligrams per day, depending on age and gender. You can get vitamin B6 from many everyday foods. Some of the best sources include chicken, turkey, bananas, potatoes, salmon, tuna, fortified cereals, and spinach. If you're eating a balanced diet, you're probably getting enough. But if you're on certain medications, like those for high blood pressure, arthritis, or tuberculosis, your body may not absorb B6 properly, increasing the risk of deficiency. Symptoms of deficiency can develop gradually, so they're easy to overlook. Fatigue, irritability, cracks at the corners of the mouth, depression, and of course, tingling or pain in the legs. If you're experiencing these signs, especially leg discomfort at night or feelings of pins and needles, it's worth checking your B6 status with a healthcare provider. In short, vitamin B6 supports healthy nerves, helps prevent neuropathic pain, and is essential for mobility and comfort as we age. But like with most things in nutrition, getting the right amount, not too little, not too much, is the key. If you want to take care of your legs, don't forget to take care of your nerves. And for that, vitamin B6 is one nutrient you definitely don't want to ignore. So let's wrap everything up. As we've seen, leg pain in older adults isn't always just a sign of aging. Sometimes it's your body's way of telling you it's missing something important, like vitamin D, calcium, vitamin B12, magnesium, vitamin C, vitamin K, or vitamin B6. These nutrients work together to keep your bones strong, nerves healthy, muscles flexible, and circulation smooth. If you or a loved one has been struggling with unexplained leg discomfort, cramps, tingling, or weakness, don't ignore it. Take a closer look at your diet, review any medications, and talk to a healthcare professional. A few simple adjustments in your nutrition could make a world of difference. And remember, supplements can help, but food should always come first. Natural sources of vitamins and minerals are easier for your body to absorb and often come with other helpful nutrients too. If you found this video helpful, please give it a thumbs up, share it with someone who might benefit, and subscribe for more content that helps you stay healthy and informed. Your support helps us create more videos like this, and it's completely free for you. Thanks for watching, take care of your health, and I'll see you in the next one.